Good morning. Yesterday was one of those pivotal days in my life. And so my day started and my day ended with the same type of conversation with two different people. And it was my tipping point. It was absolutely my tipping point. And if I'm just going to tell you right now, I probably will not make it through this video without getting emotional. And that's why I posted it on my own post instead of on the Phoenix Rising Center, but I am going to put it over to the Phoenix Rising Center because it has more to do with the Phoenix Rising Center and drugless cancer care and medical professionals than it does to do with me personally, but it does have to do with me personally because this is what I deal with every day on an ongoing basis. So this is how my day started. I had a person call me, email me actually the day before and ask me some questions, was referred to me by another person. She does thermography. And so this person was in Ottawa doing thermography, and this was someone that she was referring to me. So this particular person came to me and said to me that she had been diagnosed with breast cancer, stage 1. You need to remember that, stage 1. And that she had done complementary care and natural health care for about 4 months. And she had had ultrasound, she had had mammogram, she had had thermography done, and had it repeated 4 months later, and the mass had not gotten any bigger. And but she was scheduled for surgery to have her breasts removed because of a millimeter stage 1. She had a biopsy, stage 1 ductal carcinoma. Okay, stage 1 and millimeters in size. So I just could not believe that she was scheduled to have both of her breasts removed. So I asked her some questions. Got to understand, this person's not my patient, so I can be a little bit more frank and upfront and ask questions because they're not my patient. So I said to her, did you have blood work done? And in your biopsy, did it show that it was hormonally based? So she said, well, I don't know about blood work, but she said in the biopsy, it was hormonally based. So I said, in my opinion, why would you be having both of your breasts removed? Because that's just a symptom of the issue and it's not the root cause. The root cause of your issue is actually your hormones. So what you should be doing is you should be doing things like DIM and blocking the estrogen in your body. You should be reducing estrogen-based foods in your food intake. And so she said, well, they had talked to me about maybe doing tamoxifen. I said, well, have you looked at the side effects of tamoxifen? She goes, no, I haven't done that yet. She goes, I'm just so scared. And she says, really, honestly, I just feel like I've been bullied into making this decision because whenever I talk to anybody, all they tell me is that I'm stupid if I don't do the surgery. So that's where my bells and whistles go off. Because that's fear. That's a fear-driven decision. And no decision should ever be done on a fear-driven decision. You know what fear is? Fear is false evidence appearing real. Okay? So I explained to her a few things. So if you're going to have both breasts removed, but you're not going to actually deal with your hormones, how do you know that this is going to be effective? You're just treating symptoms again and not going to the root cause of what's going on. Have you had blood work done? Have you had your cancer markers done? She goes, what are those? What are those? What are those? Come on. I'm like, well, then I feel your doctors have been negligent in working with you and talking to you and educating you. Because there are cancer markers that she should have had done. Maybe she did, but she didn't know anything about them, and that's my point, okay? There are actually cancer markers for breast cancer, CA15.3, CA2729, CA125, and of course, she should have had her CEA blood test done. Because even if she has the surgery done and has both her breasts removed, how is she going to now monitor this? If she has not had prior blood work done for her breast cancer markers, how is she going to know in the future what's working and if it's working and if it's returning? That's why we have blood cancer markers, but she was not aware of them. And again, what I'm saying is she was not aware of them, but they could have been done, but she had not heard of anything like that being described to her. So my point is, with this, we need to be educated. People, this is your right. And when she talked to the doctor about maybe doing more alternative or complementary things as she had been doing over the last 4 months and the mass had not gotten any better, then she was shut down. She was told and made to feel that she was stupid. Now, here's what I said to her. I said to her, "Are you stupid?" So I know that's pretty straightforward, but you remember she's not my patient at this point in time, so I can say what I want. So I said, "Are you stupid?" She goes, "No, I'm quite intelligent." I said, "Well, then don't let them make you feel stupid." You see, again, if you're making a decision out of fear and not out of an educated decision, a decision that you feel right about, that's wrong. So I want to read to you something. You see, under the College of Physicians and Surgeons of Ontario, their policy statements, which I'm going to add a link under the comments to this policy under complementary and alternative medicine. This is what it says in their regulations. You know what? The funny thing is, we here that live in Ontario, we actually pay our doctors' fees through our taxes, and yet we're afraid to ask questions. And they actually are regulated under a regulatory body, which is called the College of Physicians and Surgeons of Ontario. And in their guidelines, it actually states, I'm reading it under the introduction, patients have the right to make healthcare decisions that accord with their own values, wishes, and preferences. That's pretty straightforward. You have the right to make those decisions. And then under the section that says clinical competency, knowledge, skills, and judgment, it says, when patients seek care that is beyond the physician's clinical competency, physicians must clearly indicate that they are unable to provide the care. Where physicians are unable to provide care directly, they are encouraged to refer the patient to another physician or health care provider where doing so is in the best interest of the patient or will support the patient's informed decision making. So that's how my day started. I just got off the phone and I was frustrated. I was extremely frustrated to think that this woman who feels bullied into having both of her breasts removed. So this is how my day ended. I had a patient coming to pick up some of her homeopathic remedies. She had endometriosis and she had surgery. So she went the medical route to have the surgery. We had tried some complementary care things, and but there were some complications, and so informed decision. Surgery was the best choice in this particular case at this particular time. So she was going back to her surgeon because they had recommended that she go on progesterone. In the side effects of the medicine that she was prescribed, which cost $200 odd that was going to last for a couple of months, one of the side effects was that it was going to lower her estrogen and she could go into menopause. She's in her 20s. She is not married. She does not have children. And this medication was going to make her go into menopause. It could be a side effect, okay? No guarantee that it wouldn't have, or no guarantee that it would have. But that was one of the side effects, that she could go into menopause. So she asked her surgeon, her gynecologist, if she could take a more natural product like DIM, which blocks estrogen, which has an effect on endometriosis. At that point in time, she's standing talking to me about this. She said up until that point in time, she had had a really good relationship with her gynecologist and surgeon. He was very open and polite and considerate. But as soon as she mentioned doing anything natural or not taking a prescription that he recommended, he sat back in his chair, became very sarcastic, and started rolling his eyes at her. And when she asked questions, he said, I don't know about that. I don't know about that. I don't know about that. And I'm not helping you with that. Basically, that's what he said. My point with this is you have a right. You have a right to make whatever decisions you want in your healthcare. And you know what? That's bullying. When a doctor or oncologists, and I find this in the cancer industry, that fear tactics are one of their biggest tactics. And again, false evidence appearing real. We don't accept bullying in other cases. We don't accept bullying from our bosses. We don't accept bullying in schools. We don't expect bullying from in other areas of our life where our rights and our freedoms are in jeopardy. Why are we accepting bullying from the medical professionals? And again, I am not putting everyone in the same boat. I am not painting every medical professional in the same picture. But I'm saying I'm getting tired of having my patients come day after day after day and are making decisions or are being ridiculed because they want to make a decision geared to natural health care. And I want everybody to be able to be comfortable with whatever decision they make. I had a good cry last night, and I had an even better cry this morning because I realized why this bothers me so much. Long before I ever became a homeopath, I was a natural healthcare practitioner. I focused on nutrition and iridology. I had a friend of mine bring her 16-year-old daughter to see me. And at that time, she was 16, I noticed inflammation in her liver. I noticed congestion and inflammation in her inner limbs, which is bone marrow, and in the liver and in the spleen. And so I suggested that she get blood work done. And she had a low-grade fever, and she had had a low-grade fever for months. I suggested she get blood work done. So her blood work for over a year was normal. And then it was May. I remember it was May. It was around Mother's Day. It was on a Sunday. My friend called me and said, my daughter is being transferred from St. Catherine's Hospital where they just did her blood work, and her numbers are over the top and they think she has leukemia, and she's being transferred to Jovansky Cancer Center. So my friend asked me if I would come to just listen, be ears, and write notes. So of course I went. I sat in the room where my friend's daughter was lying in the hospital bed, and my friend was there and myself was there. And I'm being extremely honest with you to tell you that I did not open my mouth while we were in that room. I did not say anything. I sat there quiet. And for any of you that personally know me, you know that that would be a challenge for me. But I was being respectful, and I was listening, and I was being a friend at that point in time. I was making notes. So when the oncologist came in and told my friend's daughter that she had leukemia and her numbers were over the top and she needed a blood cell separation where they're going to take her blood out, separate the cells, and then put her own blood back in. And they needed to do it right away or she was going to die. I sat there and listened to this. And so the girl in the bed, my friend's daughter, turned to me and said, Diane, what do you think? Do you have any questions for the oncologist? And I am telling you that oncologist folded her arms on her chest, turned to me and back to my friend's daughter and said, what right does she have to ask me any questions? Now, this oncologist did not know who I was. I had not said anything during the whole time she was talking. And Amanda said to her, my friend's daughter, and yes, I'm allowed to use their names anyways. I was trying to avoid that, but it came out. My friend's daughter turned to the oncologist and said, a year ago, Diane looked in my eyes and seen that my spleen had inflammation. There was markers in inner limbs for bone marrow and in my liver, and suggested I get blood work, and that's why I've been getting my blood work done. So I'm asking her opinion. And this oncologist went into a rage and walked out of the room. So, this morning I realized that situation started me on my journey of trying to help people to be educated on what their rights are in the medical professionals. And like I said, I am going to post the College of Physicians and Surgeons bylaws, complementary medicine health. And the only way this is going to change, the only way people are not going to be bullied anymore by the medical professionals is if they stand up and they call the College of Physicians and Surgeons and they start complaining about their doctors and the treatment that they've been given. Because remember, you pay their wages. We can no longer sit back and allow to be bullied and to make decisions about our healthcare, and especially oncology, about cancer, because we are feared into it, because we are told we are stupid if we don't do chemo, radiation, and surgery. And I'm not saying that those aren't the things that you need to do. What I am saying is that any decision you make, you need to make it because you are informed. You need to make it because you feel comfortable with the decision. You need to make it because you are in control and you understand all the options. You should never, ever, ever make a decision out of fear. Because again, fear is false evidence appearing real. And maybe, hate to say it, but maybe cancer really is, or the cancer industry is really a fear-driven industry.